Different sports carry different risks of COVID-19 transmission, depending on how close people are as they are playing the sport, whether there is contact among them, whether they share equipment, and other factors. We arrived at the low, medium, and high sports risk categories for various sports by closely consulting guidance from the U.S. Olympic and Paralympic organizations, the NCAA, and other stakeholders. You can see the quite detailed guidance that's been posted on the industry guidance page on the Stay Safe website. I'll say that we're very hopeful that if the COVID-19 health measures continue to improve, we expect to be able to resume games and competitions for medium-risk sports by the end of June. On another topic, there's just been some recent inaccurate information circulating just this morning on social media that states that MDH is charging bars and restaurants a new hospital fee. I'd just like to clarify that there is not any such new fee. We suspect that this is confusion over a long-standing hospitality fee that has been assessed to support environmental health activities since 2005. I'd like to talk a little bit about community testing. We talked last week about the fact that because of concern about potential exposures and transmission of the COVID-2 virus associated with the recent large public gatherings and demonstrations following the death of Mr. Floyd, we have been working with local partners to set up community testing sites for Tuesday and Wednesday of this week, with some ongoing over the coming days and weeks. We've encouraged folks who were a part of any of those large gatherings, including community cleanups, providing water and food to demonstrators and so forth. We've encouraged everyone who is a part of those events to seek testing, whether they feel that they have symptoms or not, over the coming days. There will be 3 sites in Minneapolis and 1 in St. Paul, and our community partners are working to finalize the details, and we'll be getting that out to communities locally. Our goal is to create these sites in some of the neighborhoods that were the most affected by these large gatherings. We have special thanks to St. Paul Ramsey County Public Health, Hennepin County, and Minneapolis for their help in setting this up. As I mentioned, we saw just over 10,000 tests processed by all the laboratories in the state yesterday, which continues a good trend of significantly increased testing volume. We have made some changes to increase accuracy in how we're reporting our lab numbers, and I'll ask KRIS EHRESMANN to explain that now. I'll turn it over to you, KRIS.
Thank you, Commissioner. I'll tell you a little bit about the changes we've made to data on our website. We're continually assessing our data and working to make sure the data on our website are understandable and that we're including information that best represents the situation in Minnesota. Starting Friday, June 5th, we made a change to how we report our lab testing data on our website. Previously, testing had been reported at the person level, meaning our numbers reflected how many actual people had been tested. But some people may get tested more than once, so those additional tests had not been reflected on our site. We are now showing how many total tests have been done, so this includes those instances where a person was tested multiple times. Testing methods and capacity have significantly changed since the outbreak started. In the beginning, multiple samples or specimens were collected for one person, and those were all run on the same day for that person. Those tests were better reflected as a single data point, so that's why we started reporting testing at the person level. Now just one sample is collected, and people may get tested more than once on different days. This test-level reporting is a more accurate approach to tracking how many tests are being conducted in Minnesota and is a better tool for determining if we are achieving the goal of 20,000 tests a day. This update to the testing data was our latest update. We've made other updates in the past that we've mentioned during these briefings, such as changes we've made in mid-May, including reporting cases by the date the specimen was collected instead of the date the case was confirmed at NDH. Updating the release from isolation measures to not include deaths, including probable COVID-19 deaths on our site,
Thanks, Chris. We will open it up for questions now, and as we do, we ask that reporters limit their questions to one primary and one follow-up so we can get to as many as possible. With that, operator, we are ready to take questions.
As a reminder, to ask a question, please press *1 on your telephone keypad. Your first question comes from the line of Jeremy Olson of Star Tribune. Your line is open.
Hi, a question regarding testing of people involved in the protests. There's been some discussion of protesters not wanting to get tested because of concerns about contact tracing or the information they have to give, or names of people they were hanging around if it turns out they had a positive case. Are you doing anything to kind of counter or deal with these concerns, which could undermine your efforts?
Hi, this is Commissioner Malcolm. I'll ask Chris to comment on this as well, but we definitely appreciate the need to communicate clearly what the value of the case investigations and the ability to follow up not only with people who are positive, but people with whom they were in close contact that may themselves have been exposed and thus able to further expose others without their knowledge. There's a lot of public education to be done about why this is so important to help protect not only individuals themselves, but their loved ones and the larger community. So we will be doing much more with communications, and I think it also speaks to the importance of having community partners, trusted sources of care, and trusted sources of information who are not only helping to arrange the testing, but who will be involved in that follow-up work as well. And so hopefully those community leaders and community voices will be trusted folks to help explain the importance of this to community members.
And this is Chris EHRESMANN, and I'll just add that, in the course of our public health work, we need to ask people sensitive questions about sensitive information many, many times over. So whether it has to do with sexual partners or illicit activities, all those things, those are things that we have to inquire about when we're investigating multiple infectious diseases. And our concern is simply making sure that the individual and their contacts are safe, and there is no part of our work that is beyond that. I would say that if people have concerns about giving names, if we would still want the opportunity to talk to them so that we could provide them with information, and if they're not comfortable giving us names, then we can help them get the information that they need to share with the people that they may have been in contact with. But just so people are aware that this is something that we deal with even before and after COVID as it relates to sensitive information in people's lives, and we treat that very seriously and are quite respectful of that, so we understand the concern.
As a related question, at least one major provider in town is still reserving its testing capacity for symptomatic patients just because of its supply, which kind of goes against the health advisory. And I know that's not a requirement, but as an advisory still, you've got providers out there that can't do this. Is that concerning to you?
Commissioner Malcolm here, yeah, very much so. I think we've had a lot of communication and conversation with the health systems about the need to broaden the testing guidance. We appreciate that they have to deal with staff and supply issues, but that's part of why we have the statewide system set up and specifically have the ability to get some of that additional support from the university and Mayo. So we want to make really sure that the systems know how to request additional supplies in one case that you mentioned through the statewide network that exists. So we're very much trying to make sure that we understand and help the health systems remove those barriers, because just to reiterate a point we've made before, it is definitely first prize in our mind for folks to get tested in the health system where they've got an existing healthcare relationship, so that the follow-up can be as robust as possible.
And sorry to monopolize, but everyone will help. Can you just quickly define that change in the data Did you change all of the testing data going all the way back to March to reflect multiple tests? Or was that just a change that started with the numbers as of Friday?
This is Chris, and no, we changed all the data.
Thank you.
Your next question comes from the line of Brian Baxt of Minnesota Public Radio News. Your line is open.
Hi, Commissioner. I saw a message from a superintendent of a large school district today to parents that they don't expect clear guidance from the Walz administration until late July about the 2021 school year. Is that the case? And what would you need to see for students to safely return to buildings in the fall?
Well, it is the case that we've been working closely with the Department of Education and consulting with school districts on their planning and have encouraged multiple scenarios to be planned for because we just don't know what the state of the epidemic is going to be at that time. There's a lot of debate and a lot of very focused study going on around the world to just make sure that we have as clear a picture as we can of not only the risk to children of getting the disease, but also their role in transmission, and that is still an evolving picture. So, I mean, certainly we hope to see the current trends improve, so that we've got less community transmission, fewer cases, fewer deaths, but very critically, less of the community spread that we talk so much about, and doing that on a testing volume that satisfies us that we're testing enough to find an accurate representation of the disease. So I can't give you a specific formula or a specific number, but we're certainly hoping to see these trends continue, but just quite honestly are not in a position yet to project with confidence that will be the case. Chris, don't know if you'd like to add anything.
Yeah, I think you make a good point that this is a constantly evolving situation, and so our team at the department is working with teams from the Department of Education on this. And as the Commissioner said, they're looking at multiple scenarios because we continue to learn things with each month. We have new information about how the virus behaves and how we understand it. So part of the goal is to make sure that there are options available for the fall so that there's time to plan, but so that we can be nimble if we have to make adaptations given a change in how the virus behaves. But all of those activities, and working on the guidance is forthcoming. But as we said, we keep learning new things, and so that's why it's a evolving process.
But is the timetable reflected in this note to parents of late July? Is that what you're aiming toward in terms of giving schools statewide an answer?
I'd have to check back with the teams in terms of what the time frame is, but they're working on guidance right now. Yeah, I think back on the date.
Yeah, this is Commissioner Malcolm. I think yes, we certainly appreciate that everybody's looking for clarity as soon as we can give it. But again, it's trying to say a date on which we will have enough confidence to make a definitive declaration. That's just where some of our hesitance comes in. It's certainly our hope and our goal to be able to give a little bit more definitive guidance, but just continued scenario planning is our best advice at this moment.
Again, to ask a question, please press *1 on your telephone keypad. Your next question comes from the line of Emily Havoc from KARE 11. Your line is open.
Hi, Jan and Chris. Thanks for taking my question here. Last week, MDH responded to Senator Housley's inquiries and provided some more information about the number of deaths and cases at long-term care facilities. Do you have a response for people who are concerned about some of this information not being public, and in addition, the inspections of assisted living facilities not being public?
This is Commissioner Malcolm. You know, I think we had heard that question about the inspection, the status of inspection records, and we're checking on that. One of my colleagues is, I think, perhaps on the phone, and I would invite her to chime in if in fact she's got any more insight on the classification of those inspection reports. I think, you know, certainly understand the public interest in knowing knowing more detail about what's going on in these long-term care facilities. I guess I would only say that we have tried to take a balanced approach between trying to protect individual patient privacy and disclosing the names of facilities that have had more than 10 cases. So that's been our practice for a while. When Senator Housley asked us a range of very specific questions, we did our best to pull that information together in about 24 hours. And so I believe that probably has been shared with a number of stakeholders, and I'll just say that I think we are always we always want to be sure that people have the context that goes with this information, like what we know about what the source of transmission and outbreaks, and how how we compare to others. And we've talked about that some on prior calls, but it's just reporting numbers without context. We think there's a limit to the value of that.
And just to follow up on specifically the inspections of assisted living facilities, are you saying that you are looking into making those public when you said that you're, kind of looking at that? Because I know they're public for many other, many other types of group homes.
Yeah, thank you for the question. I'll just see if it sounds like Assistant Commissioner Dotseth is on the line. Marie, can you chime in on that?
Yeah, thank you. Thank you very much. So I think that there might be some confusion on what was reported in there. The inspections and complaint investigations on assisted living are public and are public on our website. The information that we posted about the nursing home surveys that we did, those were specialized surveys just on infection control in those facilities over the last couple of months. So we went ahead and posted that. Those were additional surveys that we had done for nursing homes. We have not done those same additional investigations for assisted living, but what we have done for assisted living is we have reached out proactively to those providers for technical assistance, not a regulatory visit, but technical assistance on infection prevention and control. But to the extent that there are complaints or surveys for those facilities, those are public on the MDH website.
Thank you. And then I don't know if others really quickly, we're having trouble hearing KRIS. You were breaking up a bit when you talked about how testing numbers are now being reported. Could you just give a really quick summary of that? You're adding tests of people who have tested multiple times, correct?
Yes. That is very odd because usually I use a headset, and today I'm using my handset, and so it's odd to me that the handset is worse than the headset. So, but yes, I'll just sort of reiterate. We had historically been giving our testing data at the person level, meaning our numbers reflected how many actual people had been tested, but people can get tested more than once, and so those additional tests had not been reflected on our website. And that made sense initially when we were collecting multiple samples from a single person and testing those, but now we're just getting one specimen per person, and then a person may get tested multiple times. So in order to make sure that our testing data was reflective of what was really happening, we wanted to update that on the website, and that does go back for the whole time frame. Thank you.
All right. Thank you, guys.
Your next question is from the line of Bill Werner of Minnesota News Network. Your line is open.
Hi, thank you. I'm wondering if you can talk a little bit about the hospitalization numbers. They, I believe, are the lowest overall total since May 12th. Is that giving you any indication in a positive direction, or do we not have enough data at this point?
Commissioner Malcolm here, and again, I'll invite Assistant Commissioner Dotseth to chime in if you would like to add anything, Marie. But yeah, we think that's an encouraging trend, but we have seen some fluctuation in those numbers. But overall, the trend is toward a pretty stable hospital picture, and particularly in ICU. So that is good to see. We know that there is indeed, a lag time between exposure and people developing symptoms, and possibly beyond developing symptoms, feeling worse as time goes on, and then seeking a test or seeking care. And unfortunately, with COVID-19, we do see a number of people's conditions getting worse with time instead of better. So, Marie, I don't know if you'd like to comment from a data perspective, or Chris from sort of a course of the disease perspective. So, Marie, do you have anything?
Sure. Yeah, this is Marie Dotseth again. I think you said it very well. I mean, we track both the COVID hospitalizations and ICUs and overall med-surg bed use and ICU bed use. And as Commissioner Malcolm said, they have both been fairly steady over the recent weeks. So we're happy to see that. Hospitals are still relatively full, but it's nice to see it being kind of steady use.
And Chris, is there anything you'd like to add about kind of the progression of the disease in individuals that leads to hospitalization coming later?
Sure. We have seen that some individuals may have a milder illness initially, and then a number of days into their COVID experience can have the illness become more severe and require hospitalization later. So we have seen that with a number of individuals in terms of how their illness plays out. I do think that while we're encouraged to see the numbers of individuals hospitalized and in ICU drop, we also, are concerned because we have seen deaths in healthy, younger adults, and so that is very sobering. So I think that, we take encouragement anytime that the numbers, look better, but by the same token, we're still monitoring things. This is a new virus, and so we're continuing to be cautious in how we're viewing things.
Are you folks concerned? Will this hot weather that we seem to be getting into change the profile at all? Do you have any thoughts on that or any suggestions for folks?
Chris, do you want to take that?
Sure. There have been some discussions about whether or not there might be a seasonality to the virus, having to do with humidity and various things like that. At this point, we don't have good data about how this particular coronavirus will behave related to seasonality, and we'll be monitoring that. Obviously, I think as people are aware, we haven't gone through a full year with the virus, so we haven't seen the full change of seasons. So we'll continue to monitor that. If we do see a positive change with the summer weather, that would certainly be welcome, but then we have to consider, what another change in season would mean. So I think we're continuing to watch that, and there hasn't been a clear message about seasonality at this point.
Thank you all. Appreciate it.
Your next question comes from the line of Brian Bax of Minnesota Public Radio News. Your line is open.
Hey, thanks. I'm glad you got back to me. Commissioner, on Friday you used the word plateaued when describing kind of where things were at. Does that mean that, at least for this phase, this wave, I guess, where we won't peak or we're beyond the peak? Can you kind of elaborate on what you were talking about then?
Sure. And I tried to be careful on Friday not to declare that this was kind of a definitive pattern that was going to last for sure, or that we knew which direction things would go from here. But when you look over the last month or so, we've seen a fairly, a much flatter curve, or a steadier increase of cases in the 400s, 500s, 300s, with some occasional spikes back up to the 700 or even 800 range. But that's a markedly different pattern than what we had been seeing throughout April. So that I think I characterized it as it's looking kind of like a plateau with some waves within it. If you look at the epi reports of number of cases coming in or onset dates, you see this kind of repeated pattern of pretty steady number of cases each day for 4 or 5 days, and then a spike upward, and then kind of back down. So whether that meets the technical definition of a plateau, I perhaps should stay in my lane a little bit better there and leave that to KRIS and the epidemiologist. But just kind of observing the shape of the curve, it definitely had changed. KRIS, do you have anything you'd like to add?
No, I think you said that well.
And a somewhat unrelated follow-up, when it pertains to these younger people who are dying without known underlying conditions, is there much we know about when they sought hospital treatment, and does that tend to dictate how they might fare if they go in, if they don't seek the care that they might need soon enough?
KRIS, can you take that? We don't have Dr. Linfield on the call today, but we can perhaps revisit that with her at a later date. But KRIS, do you have some perspective?
We don't have any evidence to suggest that individuals did not seek care in an appropriate time frame. So, yeah.
Well, when should people check themselves into a hospital? What course of the virus? Because you say that there's mild strains and some more severe bouts with it. When should people decide that they need to actually go into a hospital?
Definitely if people are having difficulty breathing. If you're having symptoms that are within the range of symptoms that you've had before with, colds or other more common upper respiratory conditions, and you feel like you're handling them well and you can manage at home, that's fine. But if you start to question and you have difficulty breathing or any other more concerning symptoms, you should reach out to your healthcare provider.
Your next question comes from the line of Greta Cole of MinPost. Your line is open.
Hi there. So today it looks like the WHO announced that they believe asymptomatic spread, kind of contrary to what we had heard and what studies had suggested before, might be very rare. I'm wondering if that gels with what you're seeing in contact tracing efforts, and also if that kind of changes the way that we would think about things in Minnesota.
Well, I'll ask KRIS to chime in. That certainly is different than what we've been hearing, and I don't know if that's kind of a meta-analysis by the WHO or that's something some new data that they're looking at. KRIS, can you say more?
Greta, could you just restate what your initial question, because it kind of cut out right when you said the key part about asymptomatic.
Oh, sorry about that. Yeah, so the WHO, it looks like just today, officials there are saying that they, sort of contrary to what they had said might be the case before, asymptomatic transmission on another look at research actually seems to be very rare. So I'm just kind of wondering if you're seeing, because I know you guys are doing a lot of contact tracing too, are you finding that there seems to be asymptomatic transmission going on in Minnesota a lot of the time? So I guess, yeah, that's my question.
Yeah, I mean, the way we've looked at the data has not been in the manner for, say, a research study to be able to comment on that. But certainly, as you know, we have modified our activities and our interviews and things like that to accommodate asymptomatic transmission, it has seemed and consistent with what we're seeing, in say the workplace or other settings. So in other words, we have situations in which we're aware that transmission has taken place, and people have reported that they weren't symptomatic, say when they went to work, that type of thing. So no Minnesota-specific research on this, but certainly what we've seen and heard over the last weeks and months has supported the concept of asymptomatic transmission. And we'll have to look at this more fully, because to say that it's not as common as anticipated doesn't necessarily mean that it doesn't happen at all. And any asymptomatic transmission is challenging. So we'll look at that.
Thank you.
Once again, to ask a question, please press *1 on your telephone keypad. Your next question comes from the line of Jeremy Olsen of Star Tribune. Your line is open.
Just to follow up on the 20-somethings, this could be a wild goose chase, but I seem to recall about 2 separate reports of people in their 20s dying from COVID coming with a report of deaths being in behavioral group homes. I guess I'm just wondering if there's any connection between these young deaths and if we have a specific outbreak in a behavioral center or something that is particularly problematic. Again, could be a fishing expedition, but I'm just wondering.
Jeremy, this is Chris, and no, these individuals were not part of a congregate care setting, and so don't fit any of the historical profiles that we've seen in other younger deaths, unfortunately.
Were they white?
I don't have that information.
Which led into my other follow-up. Oh, sorry, if I can get one more follow-up question. I guess I'm just wondering about your concern about, you've seen all the data on disparities right now with respect to higher rates of hospitalization and worse outcomes for blacks, and the notion that many of the protesters were black. Are you concerned about these 2 trends converging, that you have a high rate of protesters who are black and a disproportionate rate of severe COVID cases? Is that raising concerns as you come into these next few days?
Yeah, this is Commissioner Malcolm. I'll start. Chris, you're welcome to chime in as well. Very much true that there seem to be converging concerns here. That that many of the folks who participated in the large gatherings were people of color or indigenous people, and we know that that not only would be expected to be at higher risk for severe disease because of their greater prevalence of chronic conditions, but and we're seeing that play out in the COVID data, as you said, with significantly larger representation in the case count than their share of the population overall. So yes, that's part of why we want to be sure that we're bringing a particular emphasis to accessible community testing in the communities where there were large volumes of people gathering, where there also are large concentrations of people living that may fit some of these higher risk categories.
Sorry, Mike, but thank you for the last one.
Yep.
And I'll just
go ahead, Chris.
I was just going to add to that and say that's why we are proactively encouraging testing of asymptomatic individuals who may have participated in events over the last weeks, as well as having the special community testing sites, is to make sure that people have the opportunity to be identified as quickly as possible. And then I just wanted to add an addendum to the question from Greta, simply because as I thought of it one more time, I just wanted to acknowledge, too, that the issue of someone being completely asymptomatic and being a case of COVID, that's one thing. But then there's also the idea that people are asymptomatic, have are infectious prior to when their symptoms are identified, and so they're pre-symptomatic, and so that's also a concern with transmission, and so that's something that we're looking at. So I guess I realize that there's two ways to slice that, and we can talk about it later, but just wanted to acknowledge that. So asymptomatic for the whole course of your illness, as well as asymptomatic and infectious prior to symptoms starting.
All right, operator, we have time for one more question.
No further question at this time. You may continue.
All right, well, thank you, everybody, and to our speakers, thank you. If you had a question we were not able to get to during the call, please feel free to reach out to the MDH Communications Office. Have a good day, and we will talk again soon.
This has been a WDIO News Special Report.